Bemben filling station no dodo. Yɛn pɛsɛ de esi circle no, ebi ɛbɛsan bɛsi ha biem. Nti yɛsrɛ aban sɛ ɔmɛyɛ yɛn mmoa na ɔmo nya adwuma na ɔmo yɛ no.
Okay. Thank you very much. So you've heard from most of the residents who feel affected by the presence of this filling station, and we are hoping that the appropriate authorities are actually watching and then they will step in to do something about it. Till you hear from us again on this very issue, this is Gabriel Obudai Togba reporting.
Of course, those were residents of Amasaman expressing displeasure over the sighting of a filling station in their community. And they are hoping that the rightful officers or the right people who are in charge of taking care of such issues come on board and intervene, making sure that all is well. This is still Good Morning Ghana. Now, on our feature segment this morning, we are talking about drug abuse. Yesterday being the 26th of June, we all know that every 26th of June is International Day Against Drug Abuse and Illicit Trafficking. And so Ghana joined the world in marking the day, and of course we couldn't have just watch the day pass by without talking about it, and then of course also creating the awareness for the public to know the essence of the day. So today we actually made it a point to bring an expert in our studio to help us discuss International Day Against Drug Abuse and Illicit Trafficking. Yeah, we need to know all there is about it. And so I have with me Mohammed Adamu, who is the CEO of Wabharm, and Wabharm is West Africa Behavioral Health Addiction and Recovery Management Foundation, and he is in the studio to help us know how Ghana actually joined the world in marking this day. What is the relevance of the day? Good morning to you, Mr. Adamu.
Good morning.
Welcome to Good Morning Ghana.
Thank you very much for having me on your program.
Thank you so much for coming. Now, this is your field. This is your sector. Yesterday, 26th of every June is International Day Against Drug Abuse and Illicit Trafficking. I was asking myself, usually like any other day that we mark in the country, we talk about it and then it passes us by. I'm asking myself, what is it that we are doing differently as we join the world to mark this day? What is it? What is the relevance of the day? And then we narrow down to governments, you and I, because we're always talking governments. You and I, we are all governments. And so we'll talk about the relevance of the day. Now tell us about this day.
Well, since the whole world is a small community now, it's a global village, and Ghana being a signatory to the International Convention on Narcotic Drugs, rightfully so, the day was celebrated before 26 because of the public holiday. Different organizations celebrated this day either through a walk or through a speech, like the West Africa Drug Policy Network had a walk on Saturday from the National Theatre to the Parliament, where a lot of awareness was raised among individuals. And I understand NACOP did have a program as well sometime yesterday. So we're celebrating it, and it's important that we're involved in the celebration because it's a worldwide thing. And Ghana, like Kofi Annan rightfully said, that drugs cause a lot of harm, but bad policies even cause greater harm to the people. And the West Africa Drug Commission actually identified that Ghana has moved from being a transit country to now a consumer country, because we are having increased number of individuals, we are having increased number of drugs staying put, drugs that are on transit either from Asia to North America are getting stuck here in West Africa, in Ghana particularly, and then drugs coming from South America to Asia are getting stuck here as well. Then we now have an added problem of what we call NPS, that's novel psychoactive substances, substances like methamphetamine, which our neighbor in Nigeria have closed down about 5 to 6 illegal laboratories where they are creating these psychoactive substances. And we don't know if it's in Ghana, but the proximity that 6 labs could be closed down in Nigeria, that is just a stone throw away, gives our security forces concerns. so that something like that is not happening here. However, for me, I think moving on from the celebration, because it's not just celebrating it as an international day.
Yeah.
It is how we localize it to our own particular situation. What is going on for us? Out of this celebration comes the World Drug Report. And over the past 3 years, this report has indicated that Ghana is actually maintaining a very high position, about third, you know, in drug use, particularly.
That's a very worrying situation, isn't it?
It is extremely disturbing.
First, second, and now third.
Yes.
I'm asking myself, what are we not doing right as a nation? Because one would have thought that after being ranked first, okay, let's say first, second, at least we, even if we were sleeping, by now we should be awake, trying to do something about the situation. But it seems as we are relaxed, and like any other day, we are just going to talk about it, make noise about it, and let it bypass us. And that is why I asked, are we really making use? What is the relevance of the day as we celebrate it here in Ghana? Because other countries definitely will embark on a course. Are we equally embarking on a course?
Well, I will say yes and no to an extent. There is something called responsibility, and there is something called pseudo-responsibility, when we have a false sense of responsibility. I think over the years, there have been more rhetorics than action, either from most actors.
Ghanaians are noted for that.
So there's a lot of talk, but one thing that has failed us over the years is implementation.
Walking the talk. Exactly.
And with that comes leadership failure in organizing actually the stakeholders, the key players. The leadership has not been inclusive of everyone on the ground.
As in coming together, as a team,
yes,
to tackle the situation.
To tackle the situation, like have an open forum, have an open mind, you know, don't nit and pick only people who are the yes people or who just wants to follow what you say.
Let's identify these officers, the officers that are supposed to come together. Now, I know the Ministry for Education is one of it.
Yeah, the Ministry of Education, especially with the youth cannabis use that's been on the increase over the years, the Ministry of Education has a very, very significant role here. The Ministry of Social Welfare has a very significant role to play here. However, leadership is needed from NACOB.
All right.
And specifically because NACOB have two remits. That is the supply reduction and the demand reduction.
All right.
Now, in this aspect of increased drug use among our youth, especially cannabis use to be specific, NACOB has a very serious role to play in this. Right. The quality of the education that is going out, drug awareness education that is going out to schools, how evidence-based is it? Do we have a strategy? Unfortunately, we do not have a strategy.
And are the structures even working?
The structures are there, but as long as we are not challenging what we are doing, we are not getting people to challenge us and to ask us questions, and we just listen to people that we think whatever we say, they will follow, is always going to be a problem. So one of the key problems is not being innovative, not thinking out of the box.
All right.
Over the years, schools have not been engaged. There haven't been like stakeholder partnership. What I personally call coalition of the willing.
Yeah.
You know, where this ministry knows that this impacts on my ministry. I'm crying out to NACOB, and NACOB going out there and saying, listen, I'm throwing this open to the people.
All right.
These are CSOs, these are government departments that needs to be involved. Carry everyone along, you know, get different opinions. A good example that worries me that over the past 3 years, we've been having the same problem. Is what I see right now is people who have been in recovery, not taking anything away from them. They are very important individuals when it comes to providing treatment and reducing number of people going into drug use. However, they are not solutions. They are part of the solution. So these individuals go to secondary schools, go to institutions and offer them awareness.
Yeah.
But you see, no leadership to vet. What kind of
evidence-based?
Is it evidence-based?
Yeah.
You see, that is the most important thing. Going to school to talk to young people is okay.
It's a good thing.
But what is the material?
Yeah.
Who is vetting that material? How is it evidence-based? And how is that material structured? there's been a research all over the world that actually going to school to talk to young people is not effective.
Right.
It only has very little impact on the short run. After the person is gone, the kids are forgotten.
Okay, so now we know that the government setups are supposed to come together and create that partnership needed to tackle the problem at hand. Now, you are the Chief Executive Officer of a non-governmental organization, which will be the West Africa Behavioral Health Addiction and Recovery Management, Wabharm. What are you doing? Since we have already identified the problems. Now, what are we doing? We are talking government. You and I, we are government. What are you doing? I know that with this establishment, definitely it means you are providing some solution or making sure that the problem doesn't continue. So let us know what your outfit is set up for.
Well, the West Africa Behavioral Health Addiction and Recovery Management is what we call an integrated dual disorder treatment service, where we work with individuals who have a drug problem or with the mental health, because we really can't separate mental health and drug problem too far away. You know, an apple doesn't fall too far from its tree. So we have two services out of the organization. That is the Laila Memorial Center, LMC, which is an open access community service where individuals, families can just walk in and seek information about any kind of drugs or any kind of mental health problems, stress management, anything. We will provide them with a free screening and advice. We have leaflets, we have information for parents, for significant orders, for teachers. If you have any concerns at all, we are in Nima of the Al-Walid bin Talal Road in Nima, just behind the president's house, you know, the Nima roundabout by St. Kizito's. That's where the center is at. It's non-discriminatory. We welcome everyone. You don't have to have any money to come there, but for a free advice and a free screening. And what we want to try and do is sanitize the addiction industry in Ghana, where when we think that somebody has a drug problem, the only thing you can do is grab them by force and handcuff them and throw them in a rehab. No, there are stages. Addiction did not just happen overnight. There are different stages, and it has to go through a comprehensive assessment of needs.
Even with that, our rehabs, are they serving the purposes for which they were put up for?
Given the condition that most of these rehabs are functioning, especially the faith-based one, given the condition, it's a very tough condition. Funding there's no funding from the state. They generate money from clients and clients' family. The standard could be better. We can work more, especially on assessment, on the kind of program we deliver, so that we don't depend just on faith-based only. Faith is a very strong and protective factor in addiction treatment, but it's not the only solution. We need to combine faith and clinical intervention. When we're able to combine the two, then we can get more response. For example, most of our rehabs now, one of the problems they are facing is community follow-up. People go to rehab for 9 months to a year. They get back home to the same old habit.
Nothing changes.
Nothing changes because you are putting them back in the same environment, no skills development. You are not preparing them to go back into the workforce.
How do they fit in society?
How do they fit in? So they go back home, sit down, get bored, and start all over again. And this kind of make families and people who pay for treatment think treatment doesn't work. So we need to get it right. Hence why we have the Laila Memorial Center. We provide free training for rehabilitation centers and people who are working with addicts. And then we provide food, breakfast for people with a drug problem in Nima area. Every morning we give them cocoa, kose, and bread.
Feed them.
And why we're doing that is not to encourage. Some people think, oh, it's to encourage drug use. No, it's more of harm reduction. We want to engage with them because drug use is not the primary problem. Everyone has a reason why they took that spliff, why they took that cocaine. It's unfortunate that the reason is often not good enough. It doesn't justify the end. So we want to sanitize through proper screening, assessment, and community-based intervention, the industry. Then we have a residential treatment facility called the Redemption House, which is a 9-month program and is in 3 phases. The first phase is basically stabilization, detoxification and stabilization, where we get people to actually understand what addiction is.
Okay.
Because once you know what is going on for you,
then
you're at a better position to address
it's true.
it. So,
okay, so Mr. Adamu, unfortunately, we don't have all the time to discuss this issue. We know it's very, very important. What will be your final word? My
final word is the leadership. I'm very happy, by the way, with the Ministry of Education.
Okay.
We've written to them, the Ghana Education Service, GES, and then the Ministry of Education. We've had a very positive response. What we are proposing to them is a 5-year strategy of working with schools. Have a program, have a named worker, and have a protocol in place where we can not just go in, talk to students and go out. No, we have a protocol in place where we'll target parents, we'll target teachers, and we target the students as well. So they've given us a very good response, and we are saying kudos to them, but we are calling on NACOB to be more open. There are other organizations out there, not to select a few, but be open to other organizations. We are willing to work with NACOB. We have so much to offer them, and we hope that they will come on board and then receive us with an open arm.
All right. Thank you very much, Mohammed Adamu. Mohammed Adamu is the Chief Executive Officer of Wabharm, West Africa Behavioral Health, Addiction and Recovery Management Foundation. Thank you so much for your time. Well, you're still watching Good Morning Ghana after bringing you details of how International Day for Drug Abuse and Illicit Trafficking was celebrated or marked here in Ghana. Time now for us to de-stress you. Of course, also letting you know what is happening in the world of entertainment. There is so much to talk about today, and I know my beautiful colleague Ria is ready to let us know what is happening in the world of entertainment. Good morning to you, beautiful.
Good morning, Harriet. You know, I was born ready for this. Good morning. How are you doing?
I am good, my dear.
How was the Salah celebration?
Well, it was just time with the family. You know, hardly do we get time to do that. So,
So
the family is always